Welcome, everyone. I'm Megan Carley, the project coordinator for the California Evidence-Based Clearinghouse for Child Welfare, or CEBC for short. I'd like to thank you all for joining us and welcome you to the webinar. Thank you all for answering the poll questions. This is helpful information for our presenters. We've muted your phones due to the high number of participants attending. So if you're experiencing any technical difficulties or have any urgent questions, please use that Q&A pod that's located on the right side of the screen, and we'll do our best to assist you. We will have a brief Q&A section halfway through and then at the end of the webinar. So please use that Q&A pod to post your questions you have. Lastly, you will receive a link shortly after the conclusion of this webinar to complete a brief and easy survey so we can continue to improve our webinars and make them as useful and beneficial as possible. Now I'm going to just do a brief introduction of our presenters. We have Jennifer Rolls-Roots. She is a research coordinator for the Child and Adolescent Services Research Center, otherwise known as CASRIC. Her work has focused on children receiving services through public sectors of care, including the child welfare and mental health systems. In addition, Jennifer has been focusing on evidence-based practices and how to more effectively implement them in real-world settings. She has a master's degree in public health from San Diego State University. And we also have Cambria Rose Walsh. She has worked for the Chadwick Center for Children and Families at Rady Children's Hospital since 2001. She is currently the project manager of the California Evidence-Based formerly the project manager of the Safe Kids California Project, or SKIP, overseeing the implementation of safe care in multiple counties in California. Cambria also worked as a therapist in the Chadwick Center's trauma counseling program for 6 years, providing therapy services for children and their families who were impacted by abuse. She is a trainer for trauma-focused cognitive behavioral therapy, TFCBT, which is rated a 1 on the California or the CEBC's scientific rating scale, which means it has well-supported research evidence. And now I'm going to pass it on to Cambria.
Thank you very much, Megan, and thank you for all of you who have joined us here today. We're excited to share some of the work that we've been doing with the California Evidence-Based Clearinghouse. We have a few objectives that we're going to be focusing on today. One is increasing the knowledge of the practical use of the CEBC website. So we will be doing a brief background on what you can find on the CEBC website. So we will just do that briefly to make sure everybody's at the same starting point in terms of understanding the project and the information that you can find on our website. We will then move into understanding the importance of exploration, which is the initial phase of implementation, and then learning ways to apply lessons learned from the work that we've been doing in the areas of exploration to your own communities. So without further ado, we will move right into our information here. This is the homepage of the California Evidence-Based Clearinghouse for Child Welfare. So if you have not been to our website yet, this is what you will see when you do go visit the website. If you have been there, this should look very familiar to you. The CEBC project actually began in 2004. We're funded by the California Department of Social Services through the Office of Child Abuse Prevention, and we are a partnership between here at Rady Children's Hospital between the Chadwick Center for Children and Families and the Child and Adolescent Services Research Center. We have a lot of guidance that comes for our project from two very important governing bodies. One is our advisory committee, and the other is our scientific panel. The advisory committee is made up of members mostly from the state of California, and they have a very important role, and they help us determine which topics we add to our website and also act as kind of a sounding board for us as we make changes and improvements to the website. We have one member on our advisory committee who's not from California, and that is a representative from the Information Gateway, which gives us kind of a federal conduit into information that's going on the national scene. Our scientific panel is comprised of 7 members, and they are, some of them are here in California, but that's just coincidence that they're in California. They're chosen based on their knowledge of the research in child welfare. And they hail from many different parts of the United States, and their main function is to help us, in the beginning, to help us create the rating scale that we have on our website, and to help us in continuing to make refinements to that, and also helping us as we come up against some of the interesting research issues that we need to address in the day-to-day work that we do on the CEBC. The actual website was launched on June 15th of 2006. At that point, we had 2 topic areas and about 17 programs. And here we are several years later, and we now have 36 topic areas with over 280 programs. And that changes daily. We're adding several new programs next week, so that number will no longer be 280. It will go up significantly, and continues to do so as we add new content onto the website. The goal of the CEBC is to provide easy access to information about a child welfare related program through a user-friendly website. So we really try to distill down all of the essential components of the program and the information that some of our programs don't have research, so the fact that we're called the California Evidence-Based Clearinghouse does not mean that all the programs that are on the website are evidence-based. In fact, many of them are not. And our information is arranged in topic areas. So as I said, we have about 36 topic areas. And we provide both brief and detailed summaries for each reviewed program. So you can determine the level that you want. So if you just want to briefly go through and find out a little bit of information about a program, you can skim through the brief summary and fairly quickly get a good picture of what that program does. If you want more detailed information, down to how do I get training on this program, what languages is the program available, you can dig deeper into the detailed summary and find out much more detailed information. And as I mentioned before, the programs are rated on the level of scientific support. What we know about evidence-based practice in child welfare is that there is not as much known about that in other areas such as medicine and mental health. And when we started this project back in 2004, no one was really looking specifically at evidence-based practices for child welfare services and populations. We know that it is a unique population with complex needs. If you look at the topic areas that we have on the website, you will note that many of them are not services that are actually provided within the child welfare system, but they are services that may be contracted out and provided for families that are in the child welfare system. So there's a lot of applicability to mental health and juvenile justice and the other fields that kind of surround child welfare as well. In terms of our definition of evidence-based practice, we look at components of EBPs, and this comes from our cousins in the field of medicine, the Institute of Medicine. We look at the best research evidence, the best clinical experience, and the consistency with client and family values. What we found is the best research evidence. That's our main focus, is to provide what research is out there. What the people who utilize our website have to do then is make sure that they are hitting these other 2 circles, which is the best clinical experience and the consistency with family and client values. You can have a practice that's rated a 1, which is our highest rating, which you would then say, okay, that has a lot of research evidence, this is a great program, but if the people who are implementing it and who are actually carrying out that program don't have the necessary clinical skills, it's not going to be a very effective program. And if you're not using it within a system with families and clients, that it's going to match with, then it's not going to be a very effective program as well. And that we'll talk about a little bit more as we look into the next section of the presentation in terms of talking about some of the lessons learned that we've had in terms of the work that we've been doing, applying the knowledge from the CEBC. So what we bring to the equation, as I said, is the best research evidence. This is our scientific rating scale. It is a 5-point scale, with 1s being at the highest end and the 5s being at the lowest end of our scale. To be a 1, you have to have 2 randomized controlled trials, and you have to have at least sustained effect of 1 year in one of those RCTs. And then it goes down from there in terms of the requirements to meet the different those other 5 levels. And we do have quite a few programs that fall into the not able to be rated category. You can certainly go onto our website and you will see the same graphic under scientific rating scale, and you can click and get very detailed information about what is required in order to meet each of these levels. In the interest of time today, I'm not going to go into detail on each of the rating levels. So the other thing that the CEBC brings to the equation is detailed information to help you determine if the program would be consistent with the family and client values and if the program would fit what your clinical experience says is needed. So for instance, when you go in and look at a specific program, it will tell you what the minimum provider qualifications are. So is this a program where you need to have somebody who has a master's level or some sort of licensure? Is it a program that can be implemented with bachelor level staff? They need to have a specific focus. Is it clinicians? Is it nurses? What type of personnel do you need in order to run this program? And we also look at, as I mentioned before, the different languages that programs what the goals of the program are, and you can look into the research and see what populations the program has been utilized with. We also welfare, or has it just been done in the general population? So you're able to find information about that on each program, and we do rate them high, medium, or low. We also examine whether program has outcomes related to the Child and Family Services reviews in their published peer-reviewed research. So we looked at safety, permanency, and well-being, and what the research on the programs tells us about each of those areas. This is the topic clusters in terms of what's currently on the website. So we have programs that fall into the areas of anger management, domestic violence, and substance abuse, into behavior management, and that includes parent training. We also have some core child welfare services, including placement and reunification. We looked at programs in the areas of engagement and parent partnering programs. We've looked at mental health, both for children and adolescents as well as for adults. We've looked at prevention and early intervention, and we've looked at programs in the area of support services for youth in the child welfare system. This includes looking at programs like mentoring and also youth transitioning out of care and what types of programs are out there to help with that. There's a specific list of all 36 topic areas available alphabetically on the website as well. This graphic shows the breakdown of CEBC programs by scientific rating. So as I mentioned before, we do have a lot of programs on they're being utilized within child welfare, and we want people to be very clear about what level of research there is for different programs. So just because a program doesn't have research on it doesn't mean that it doesn't get put on our website, but we're very clear that those programs are not able to be rated, that they don't meet the threshold of research. And then we do have programs rated 1, 2, and a 3, which are our highest level in each of those categories, and you can see the breakdown here as well. We have some other materials on the CEBC website that can be helpful for our users as well. We have reviews of commonly used screening and assessment tools. We also have training materials, webinars like this one that are recorded that you are able to see, as well as some online tutorials that give information about how to use different parts of the website, about our definition of evidence-based practice, etc. And then we have some implementation resources. We've put up a selection guide that helps you look through and decide, helps break down some different things you want to look at when you're deciding between multiple practices, which one might fit best in your community. And we also have program-specific resources on implementation. Within all the programs right now that are rated a 1 or a 2 on the website, there is information about implementation resources that are available for those particular programs. So again, I'm just going to show you a few quick things about our website here. This is an example of the brief summary of a program. So this is 123 Magic. And as you can see, there's a very brief description and the contact information. It gives you the scientific rating as well as the child welfare system relevance rating, and then the option to click in to see the detailed report. And if you were to click on the detailed report, you would see much more information. It gives you, as you can see, its essential components. And if you were to continue to scroll down, it would give you information on the child and adolescent component, if there's a parent or caregiver component, information on the recommended parameters, the resources needed to run the program, minimum provider qualifications, education and training resources, the implementation information, since this program is rated a 2, and then the information on the relevant published peer-reviewed research, as well as references, and then the contact information rounds out what's in there. This is what you would find in the implementation information section. So we asked each program whether they had any pre-implementation assessments, whether they have any implementation tools. So again, something that you may want to look at when you're making a determination about whether this program would be a good fit for you. If you need a program that comes ready-made with a lot of help around implementation and support around implementation, then you want to, obviously choose a program that has fidelity measures and pre-implementation assessments in place, or you're going to need to think through how you're going to look at those particular aspects for the program, since the program doesn't come with that information. This is the relevant published peer-reviewed research section, and so for each research study, we indicate the citation for the research, and then we go through and give you just some brief information about the type of study, the number of participants, a little bit about the population, where the study took place, and then a brief summary of what was found, as well as the length of post-intervention follow-up. And by looking at these research studies, you can very easily see how the programs were rated with the information in here. It gives you the randomized controlled trial, the length of post-intervention follow-up, etc. Now, if you wanted to read the entire article, you certainly could do that by taking the citation and getting the entire article to look at. This is our implementation resources section, and in here, as I mentioned, we have our selection guide. We also have some information about different implementation approaches that are currently being utilized. There's information on breakthrough series, community development teams, ARC, and then there's also some information on implementation approaches that are being utilized in other fields similar to child welfare that might be applicable. So you can certainly go in there and in depth be able to learn a little bit more about the different implementation approaches that are out there. And this is our selection guide, as I mentioned before. This is based on information from the work of Trish Greenhall and her colleagues out of the UK. And she conducted a systematic literature review that addressed the question, how can we spread and sustain innovations in health service delivery and organization? And so we used her key findings to design this guide. And for each key finding, we presented a key question that agencies should consider, where in the CEBC's detailed view of the program description you might be able to find information to help you answer that key question, and then an example of how that key finding can be applied to a real-world situation. So again, this is to help you start looking more in depth at a program to figure out if it would be a good fit within your particular system. So I'm going to pause here and see if there are any questions that we have at this time. And I believe those, you can type any questions that you have into the Q&A box. So just a moment to see if there's anybody who has any questions, and then we will move on into the second part of our presentation. And you'll have an opportunity to ask questions again at the end of the presentation. All right, so we're going to move on to our, we have a couple of polls that we wanted to ask before we move into the next section. We do have one question. Is the CEBC able to provide technical assistance to sites during the process of implementing new programs? So I'm not going to answer that question in depth because that's what we're going to kind of talk about in our next section. But what I'll tell you is that our major focus at this point is providing technical assistance around the exploration phase, which we'll describe to you, which is kind of the selection process piece of things. It is not providing technical assistance around implementation of a specific program, but I think that will become more clear as we move into the next piece of the presentation. Are there measurable outcomes included? I'm assuming that means within the research, but I'm not real clear on that. So maybe whoever threw that question and can give us a little bit more detail. And again, I think in the next section, we can certainly, in our next pause, we can answer that particular question. So let's go ahead and work on our polls. So our first poll is, how have you used information on the CE? The numbers are coming in here fast and furious. All right, looks like it's slowing down. Wait just another moment. You can pick more than one answer. We'll have numbers changing a little bit here. All right. So it looks like the majority of people have used it as for general information on the programs. There's also some, about 26% that have used it for implementation. And then we have a large number, 28%, that have never visited the CEBC website. And then sprinkled among the other ones, there are some who have used it for RFP development, proposals, monitoring, and for logic models as well. Excellent, that's very helpful. And then I think we have a second poll. So the second one asks you to think about how you might use information on the CEBC in the future. And again, click on all that apply. I'm going to turn it over to Jennifer, who's going to talk about the results from this one and move into our next section. Okay, we'll just give another minute on this one and move on. Looks like it's slowing down, so I'm just going to go ahead and broadcast those. Excuse me. So similar, a lot of use of the CEBC for general information on the program, and it looks like we've got a lot of people who are thinking about using it for other things. Implementation obviously being an area of great interest for a lot of people, but also proposals, monitoring, logic model development, and so on. Okay, so I think we'll go ahead. Okay, there we go. Looks like it's coming up in a second. Okay, so this section will focus more on what the CEBC is doing in terms of implementation, and then again at the end we'll open up some questions and address some of the ones that may come up during the session. So feel free to put questions in throughout the presentation. We'll get to those at the end. So the purpose of the CEBC is to be a neutral source of information on evidence-based practice. We've got our kind of mission statement to help identify and disseminate information regarding evidence-based practice. So in order to be neutral, we really can't support the active implementation of any specific program, because that would be basically endorsing it. We already do provide information on implementation resources for our programs that have a rating of a 1, 2, or 3. So we've been looking at ways that we can help support implementation without actively supporting a specific program. So we are focused here in California. We're funded by California, and we work a lot with counties in California, and what we hear from them is that they need help in very specific areas, determining what service areas need to be targeted and what the evidence-based practice options would be for those target areas, helping them figure out which practice would be the best fit in their current system, and then also, of course, planning for implementation. How do they go about moving a new practice into their system? So we began about a year and a half ago offering something called the Assessment and Planning Initiative. In the community. And what we do is a basic needs assessment, which looks at the current level of evidence-based practice in the community. We do a web survey, and then we also do either in-person or telephone interviews to follow up as needed. And then we provide the county assistance in looking at what data they have available to analyze their own needs within the community. And then what each county gets out of this is a roadmap, which gives them an individualized plan of how to increase the use of evidence-based practice, as well as several evidence-based practices that would be new to the community that they may want to consider based on the needs assessment. And throughout the process, and also after the roadmap, we provide in-person phone and email consultation. Our first county that participated was Tulare County. They're in Central California. They initially identified 6 areas they wanted assistance with. We narrowed it down to 2 through our consultation process. And so they focused on parenting education and aftercare services, so post-reunification. And just to give you a quick overview of what we found, in parenting education, when we did our needs assessment, kind of our snapshot of what they were currently delivering, we found that they to target their referral system a little bit better to make sure that the right child and family were getting to the most appropriate practice that they needed. And this is actually something common. We'll talk about this again in a few minutes. In terms of aftercare services, again, they had contracts in place for these services, and what they needed to look at was what were the desired outcomes that they hoped to achieve from these services, and kind of formalize a little bit more what the services were that were currently in place so that they could assess outcomes as they move forward. And then we also gave them the suggestion, because they had developed the aftercare services locally, that if after a certain period of time they felt they weren't achieving their desired outcomes, we gave them several different or actually we just are starting the same process with Riverside County here in California, and that'll take place this spring. So other ways that the CEBC supports implementation, obviously we can't work directly with every county in California or across the country, so we're trying to come up with ways that we can support implementation in a more indirect way. We know that implementation is not an easy process. Bringing in any sort of change is not easy. Evidence-based practices are not one size fits all. So just because it worked for the county next to you or another agency in your county, it may not necessarily work for you. And that we know that agencies need assistance throughout the entire implementation process. An entire arm that is devoted to ensuring that MST is implemented correctly. MTFC has a similar system in place. And many EBPs already have readiness checklists and other sorts of implementation tools. But these actually assume that you already have identified the practice that you want to use, that you've already said you're going to implement MST or MTFC. And what we found from counties is they actually needed help on deciding what new practice to implement or determining what was needed. So from our discussion with counties in California and also people across the U.S., because we have a lot of CEBC users who are not from California, the most common implementation mistakes that we were hearing about was picking a new practice basically because you heard about it at a conference the underlying data. So what do you know about the program area that you want to address? Have you now really dived into the data to determine what the problem is and what you need? And so we would say, before you seek the answer, always be sure you're asking the right question. Because if you implement a program that doesn't address the problems that you have, you won't get the success that you're looking for. So here's some examples. A county contacted us wanting to reduce reentry through better post-reunification support services. So our first questions back to them were, how do you know that you need better post-reunification services? What's the data that you've looked at to show you that you have post-reunification or reentry problems? So they did have some for that reentry. So start your process with looking at what's going on and help you determine what would be the most appropriate program to address those. And so we talk about this as being the earliest phase of implementation. So in the CEBC, we use something called the EBPs model, or phases of implementation. And the first step in this model is exploration, which is really looking at what you need and helping you determine what once you've identified your practice, making sure that you do everything to set up the implementation correctly. The third stage is actually the true implementation, when the program begins to be delivered. And then lastly, we have sustainment. And we would say that you need to be thinking about sustainment from the very beginning. How are you going to keep this practice going? So at the CEBC, we realized that we could probably be most effective helping with the exploration phase, so actively considering a new practice. You want to make your services more evidence-based. What can you do? How do you do this? So you've got the awareness that you have an issue that needs to be addressed, and you need to determine where you're going to move. In. So in this case, it might be a parenting education program is not having the desired outcomes. So what would those outcomes be? During the exploration phase, there's some very important tasks that have to occur. We recommend that you work with stakeholders to identify the factors that might be affecting implementation. Again, with implementation, you're making change. It could be a small program. It could be a broad system-wide intervention. But you want to make sure that you're involving your stakeholders from the very beginning so that they are a part of the process in bringing in any new practice and that they are bought in from the very beginning. So things you have to consider with your stakeholders: funding issues. How will you fund new services or change the service that you're currently funding? What are the existing policies and practices, and how will these potential interventions fit with those? What are your staffing issues? Like Cambria mentioned before, do you need to have licensed staff, or can you rely on bachelor's level staff? How is that impacted by the availability of staff in your local community? A key step is determining what areas you want to address. With our communities, we say, pick 4 or 5 areas that you have interest in, and let's work through those areas. So you can do the same thing. Where do weaknesses currently exist in your services, and what's the data you have? What are the outcomes you want to see in those areas? And we would say, drill down past the symptoms to get to the causes. So ask why 5 times. So if your problem areas, you identify post-reunification services, why? Because you have higher than anticipated reentry rates. Continue to ask why. Why are those rates higher? Look at things like, which populations does this apply to? Is it across the county or across the state? Is it particular geographic areas? Is it particular racial ethnic groups? What's going on? Phase, you also want to consider the potential evidence-based practices that target the areas that you want to address. And so that you can use the CEBC for this to look at what are the programs that address this topic area. You want to start developing internal support for these changes, making sure you're involving both administrative and delivery staff. So if this is a change that's going to involve bringing in a whole new program, you want to make sure that you've got support across the continuum at your agency in support of that. And again, it's considering the fit of these practices within your organization. How will the practice or the new practices fit in your supervision process? How will they work with IT, documentation, referral process, and so on? These are all things that you have to consider when you're even selecting a potential practice. So I've got another example here. This was, again, from Tulare. They had their evidence-based, they wanted to make their parent education more evidence-based. And what we found was that they had parenting education practices in place that were already well established. But in this case, they weren't thinking of all of them as parent education because they weren't all traditional classroom-based programs. So at the CEBC, if you go to our parent training topic area, you'll see a wide range of interventions. So by helping them look at what they had in place across the continuum, we identified for them a variety of parenting education programs. And then we needed to have them look at it as a continuum. So you might start by referring someone to a group-based program and then move to something more intensive if it's needed. We also help them realize that parenting education is not all equal. Most parenting education programs have a very specific focus. And so you need to make sure that the parenting education program that you pick is targeting the outcomes that you desire. With regard to parenting in general. And then also we find parent education tends to focus on ways to address difficult child behavior, maybe clinical or subclinical, but handling child behavior. So for example, if you are putting in you want to reduce neglect in a population, you would probably want to select a parenting skills parenting education program as opposed to a parenting program designed to deal with difficult behavior. So again, it's looking at the outcomes that you're desiring and what your county needs and helping that drive the program that you pick. What we also would recommend is that more is not always better. So we'll find situations where families are being referred to multiple interventions that have very overlapping outcomes. And so again, it can be more than a family can handle. And so by fine-tuning the referral process, you can make sure that families get what they need, but they're not getting more and more interventions piled on top of them that can actually cause some conflict. Another example of the exploration phase focused on mental health services that they had available for the child welfare population. And in this county, they contracted with multiple providers to deliver services to the child welfare population, but they didn't really know exactly what was being delivered by the providers. So what we found out through the needs assessment piece was that they did have evidence-based practices in place, but they were not always being used with the appropriate target population. So again, if you can have a great intervention, it can be well established, rated a 1, but how or why that particular practice was selected. And what we see in many areas is that the intervention or the provider is determined strictly by geography. So for example, a county may be regionalized, and so children living in a particular region are referred to providers in that region, and that determines what their accessibility is to services. So we advise that counties, states be very thoughtful about how they refer clients to services and make sure that they're referring them based on the client need and the availability of service that might meet those needs, and not strictly on things like who's the closest provider. They may not provide service that that child or family needs. So in this case, what we advise them to do is to take a look at their assessment and referral process. We felt they didn't really need to bring in new evidence-based practices, but they needed to fine-tune how they were getting children and families to the correct intervention, the appropriate intervention. We also found in this county that they had several evidence-based practices that were available locally, but the Child Welfare Agency was not referring to them. They weren't even aware that the providers offered those services, which might be very applicable to their population. So during the assessment process, we asked all the providers not only what services do you provide to the Child Welfare Agency, but what other services is your agency able to offer, what evidence-based practices do your staff have experience in, are certified in, and so on. And so in this county, there were several practices that were very relevant to child welfare that weren't being used strictly because the Child Welfare Agency wasn't aware. So in this case, again, it was awareness of what's available locally, making sure that you are referring to the most appropriate practices. Okay. So direct ongoing support from the CEBC. So we're putting together some information on what we've learned and how we can help guide counties or states through the process. So in a quick summary of how we would recommend that you start with the exploration phase. The first piece is always going to be getting together a small group of individuals to work on the project. So your county may have identified through your SIP process or some other internal group that you need to make a change to services or that you want to bring in a new practice. Start by setting up a group who's going to work on this for the duration of the project. And you may already have a group in place. You might have a child protection planning committee. You might have some sort of commission that's local. You could use that group, or you could establish a subcommittee. We would advise you to keep it to 10 people or less. If you get much more than that, that group will get unwieldy, and you won't, group dynamics won't help you here. We also recommend that you incorporate different types of members. So as you mentioned before, you want to have administrators. We also recommend you have supervisors, frontline staff if it's an intervention that's really going to affect direct service providers. Have your contractors, have your mental health providers, your home visitation providers, whoever is relevant to the topic area that you're interested in addressing. Also involve your stakeholders, involve the community, involve families and children who are involved or have been involved in the child welfare system. They can provide a very valuable perspective on how the end user is going to feel. So involve your key stakeholders. After you've got your group together, start setting the stage. So as we did, identify what your potential areas of interest are. So don't go into the process saying, we definitely know we want to implement this practice. We say take a step back and help identify what those practices are, what the areas of interest are. And look at your data. What do you have about the problem area that you've identified? What do you know about the population, your indicators of need? Do you have anything about referral rates, retention in services? If you have existing contracts that are addressing this area, what do you know about them? What number of families are they serving? Are they assessing any outcomes currently? Do they have waiting lists? Basically anything that you can find. And there is more and more attention being paid now to data, obviously as part of the evidence-based practice movement. And there are some resources that are available across the country to help child welfare agencies learn how to use their own data in a more analytic manner. Probably the largest one right now is Chapin Hall has a data analytics essentially course that they offer with ongoing support. But there are other places that are offering that as well. So if you don't have the skills locally, you may want to look into how can you help your local staff build their skills in the area of looking at data. Once you've identified your 3 to 5 areas, you're going to have to narrow that down. We would recommend that you pick 1 or maybe 2 areas to work on. And the number obviously would depend on how much support you have for this process in your area. If you maybe you've had some experience locally with implementations that have gone wrong. We know this happens pretty regularly. So if you have a negative experience in your county, you want to start small and you want to start as positive as you can. So pick 1 area to work on. And we would say pick the low-hanging fruit. So if you have an area that might be a little easier to start with, go ahead and do that one first so that you'll have success and you can build on the positive experience to go on and do later implementation. When you're narrowing the focus, you want to make sure that you've clearly defined the issue and the outcomes you want to see from any practice changes so that you know what exactly you're hoping to get and what the desired outcomes are, and you can be aware of that as you're moving through the process. In terms of exploration, identifying programs, the CEBC is obviously where we would refer you first, but there are many other resources that you can use. Talk to others in the field. Most states and California, I know, has the Child Welfare Directors Association. You can talk to people who are in similar roles. But regardless of where you go to look for programs, you always want to put together some sort of written document. It could be a very formal document. It could be just a basic table, but have a written record of what are the programs that you considered. And as you're going through the selection phase and looking at how the potential programs will fit, you can keep a record of why you chose a particular program based on the characteristics of the program. So we use what we call the CEBC selection guide, and this is about a list of potential programs to determine which one would be the best fit, both for the needs that you've identified, as well as things like the skill set, the knowledge required to use it. Can you try it out before you fully implement? What's the level of support for it, and so on. So as you mentioned before, an evidence-based practice in our eyes is not just the practice that has the most research behind it. It also has to fit with your needs and the needs of your local community. And you have to have things like the right skills to deliver it. It has to be a fit with what your community values are. So these are all things you have to determine during the exploration phase to identify the practice that's most appropriate for your community and your exact situation. And we remind people that don't just pick a program based on the number. So there might be a program that's rated a 1, the highest level of support on the CEBC, but it might not be the most appropriate practice for you. So don't just get caught up in the numbers. You need to look at everything else that's going on as well to find the one that's truly the best fit. So at the end of the exploration phase, you want to identify 1 or maybe 2 programs that are good fits that you would be comfortable with implementing, you meaning your small group. And then take these back to your larger group or whoever is going to have to give buy-in on this. Again, go back to your stakeholders, maybe have community forums. And how broad you need to take this feedback really depends on how big the change is going to be. If you're just bringing in a program that affects a small number of people, you can keep it small, but if you're going to be bringing in some system-wide change, you want to obviously have more support for it. And then put it in writing. Again, if you're making a change, you want to be able to show the steps that you went through, the process and the feedback that you got, and you want to make a clear recommendation. Your committee did this work, here's all the effort that you made, here's the program that you've identified, here's why, you've got all your support for it. And then you want to end the process by determining how the next steps will occur. So what's going to happen once you've selected your process or your intervention, and now you're going to move forward into the next phase of implementation, which is preparation. And what we have found with preparation general pieces to the preparation phase, but most of preparation is very specific to the particular intervention that you've selected. I've got some additional examples, but I think what I'm going to do, because I think we have some questions, I'm going to just flip through these. These are on your PowerPoints, and everyone who attends should have gotten a copy of the PowerPoint, so you can go through these on your own. And here's some information about preparation. Again, things like working with the developer to see what assistance they offer, things like staffing decisions, setting up a clear timetable, how you're going to do training, and so on and so on. So lots of things. Before we move into questions, just a couple final thoughts. Successful implementation of any new program requires careful planning, thoughtful selection, and detailed preparation. And all of this needs to occur actually before anything is even implemented. So this is all just the very beginning step. And this is really where the CEBC feels like we can provide the most assistance to counties and states across the country without the direct hand-in-hand support that we're able to offer through our initiative. For those who haven't visited the website, we've got our email alert that you can sign up for. I'll put our contact information up, so if you have additional, more personalized questions, you can put that there. But I'm going to take a look at the questions that have come through while I've been presenting. We'll address a few of those and get everyone out on time. So it looks like first question we have, as we implement new programs, we require that providers include outcomes in their programs to report to us on regular intervals. Is there a specific point on the website's compilation of program information that would assist a funding organization's ability to recommend what outcomes we give to a provider attempting to offer one of the programs? Okay, so the first thing that I would say is you want to look at the goals section. That would be for the program developer, what are the goals of this program? We've got that in there. You can also look in the research summaries. We provide information on the measures that were used during the research. And some of those may or may not be appropriate for clinical or real-world practice, but at least it gives you an idea of what types of measures they used to look at the outcomes. And they really vary. They could be an existing tool that could be used, like a checklist or a measure, or it could be things like recidivism rates, re-abuse rates. So there is a variety of outcomes that are used in the studies. And really, in terms of, we always recommend go to the developer of the particular program you're interested in. They should be able to provide you some consultation and support on what sorts of outcomes would be appropriate. Again, make sure you're using something. It's very important that you are assessing outcomes across these programs. Is there a cost, next question, is there a cost to the needs assessment? No, the needs assessment that we're doing through the initiative process is funded under our contract with California, so that's why it's restricted to counties in California. And so we are trying to provide more information that will be available on the website. There will be no associated costs with those materials, but they wouldn't be done in conjunction with CEBC staff. So we're trying to develop more kind of self-assessment tools, give you information. Our county in California, we will likely be opening up the initiative next year, so be looking for an email. It usually goes out through the Child Welfare Directors Association as well as through CEBC directly. Someone in here from Riverside had some specific questions, so go ahead and contact us using the email that's listed on the slide in front of you, and we can get back to you on that. Okay. So another question. I wonder how much county mental health agencies actively collaborate with the Child Welfare Agency in creating the mental health contracts that serve youth and families in child welfare. My sense is that this is an area that needs improvement. I would say, yes, it needs improvement, but we do know, and we have research showing that when there is more effective collaboration between the child welfare and mental health agencies, that the service delivery is much more effective. So we did a study through CASRIC, the Child and Adolescent Services Research Center that I work for, that looked at this particular issue in 100 child welfare agencies across the country. And what we found is that when they were better, there was better meaning that the kids who were being referred for services truly had clinical need. And we also saw a reduction in disparity in use of mental health services for African American youth who were in the system. So we know that disparity in service use is a concern across child welfare. So to see that outcome was very positive. So collaboration obviously is an area that needs improvement. One thing we would recommend is that you start looking at what are the avenues for collaboration locally. Do you have a multi-agency group that meets? Do you have a system of care council or something similar to that? Do you have a formal way for these agencies to get together on a regular basis and start the collaborative process? So that's definitely, collaboration is very key. Let me see, I think we have time for a couple more questions. I'm from a county subcontract agency. Does the CEBC ever provide consultation to subcontractors or just to counties? We really are kind of open to providing at least informal assistance to pretty much anyone. So people have questions, they can certainly contact us through the email on your screen. It really just depends on the amount of assistance you're looking for. Sometimes we can refer you to others who can provide that assistance you need. But if you have questions, go ahead and contact us, and we can certainly help you or point you in the right direction. Someone asked, is the needs assessment instrument available on your website? Not currently. So we will hopefully have this up probably within the next 6 months, 8 months. We're currently working on what we're calling the CEBC guide implementation, and so that will be part of this. If you sign up for our email alert as soon as it's available, it will be put out through there. If you have specific questions about the needs assessment, you can certainly contact us directly through the email posted. I think our last question before we sign off, you explained your assessment process. How long does that take? Well, it kind of varies. It will depend on the size of the county, how many different providers are involved. Again, we're focusing in California, so we're a county-driven child welfare system. So that makes it a very discrete county-wide entity that we're looking at. Some counties contract out for a lot of services and might have multiple providers who we have to work with. So the process can take longer the more providers that are involved. Again, it also is determined by how fast the various involved parties participate. So we do a web survey. If we can get response quickly, we can get the answers back a lot faster. But usually, I would say the process will take a couple months, kind of from at least from start to finish, depending on the availability of the parties that are involved.